Good afternoon, everybody, and welcome to our Pi Day of Giving virtual speaker series event. Today's topic is Virtual Rehabilitation, a Promising Way Forward. Before we start, I'd like to start with a land acknowledgement of the traditional territory in which we are gathering today. Our university campus is situated on the traditional territory of the Mississaugas, a branch of the Greater Anishinaabe Nation, which includes Algonquin, Ojibwe, Odawa, and Potawatomi. Because everyone is turning in with us remotely across a variety of cities, I don't want to forgo this important element of reconciliation. So I'd like to ask that everyone take a moment to reflect on the traditional territory on which you're on, the treaty that it's covered under, and your own personal relationship with the land. As a university community, we are dedicated to increasing our awareness, understanding, and gratitude for the lands in which we share. My name is Jody Cowan, and I'm the Community Engagement Coordinator here at Ontario Tech University. Thank you for joining with us for today's session. Today is with Dr. Pierre Côté from our Faculty of Health Sciences. It's the second of 10 sessions we're hosting with our Ontario Tech experts to share their research and to spread the word about our Pi Day of Giving. This will help raise funds for our Student Relief Fund, which helps our students who are experiencing financial need due to COVID-19. Now, there will be time for a Q&A following the presentation, so please use the Q&A function at the bottom of your screen at any point during Dr. Côté's presentation, and we'll do our best to get to your questions. This session is being recorded, and we will be posting it on our website, so you can watch it again or share it with your friends who are unable to make it with us live today. I'd now like to introduce Dr. Pierre Côté from the Faculty of Health Sciences. Dr. Côté is the Canada Research Chair in Disability Prevention and Rehabilitation. His research interests include the study of the management and prognosis of musculoskeletal pain, mental health, and disability. His work aims to identify modifiable risk factors and design interventions that will reduce the burden of chronic pain and disability in our population. He is also interested in the translation of scientific evidence into policy. Now I'd like to turn it over to you, Dr. Côté, for your presentation on virtual rehabilitation, a promising way forward. Take it away, Pierre.
Thank you very much, Jody. I will share my screen, and good afternoon, everyone. And thank you so much for sharing your lunch hour with us. I have to tell you that as someone who's been interacting with students over the past year, I am amazed every day by the resiliency that the students at our university have shown. And I am truly impressed by how they've adapted to this challenging situation. So I thank you very much for supporting our student body and for contributing to their future success. I'd like to talk to you today about a topic that is very close to my heart and that I'm very passionate about, which is the world of rehabilitation. And I'd like to use the lens of an epidemiologist. I know most of you will have heard that term a lot during the pandemic, to look at how we can actually move the world or the field of rehabilitation forward, given what we've experienced in the past week, and how our university can really play a role nationally and globally in influencing rehabilitation and helping people with disabilities. I think it's important to first define rehabilitation, and because there's been a lot of misconception about what rehabilitation is. Rehabilitation is really a set of interventions that are designed to improve or optimize function and disability with health conditions in relationship and interaction with the environment. So although rehabilitation has been traditionally defined as caring for individuals with severe conditions or severe injuries, rehabilitation is much broader than that. In fact, if some of you today are wearing glasses, hearing aids, or you're wearing some kind of support to help with your back pain, these interventions are all part of rehabilitation. So rehabilitation is really part of our daily life, whether we seek healthcare or whether we interact with the environment. And in fact, there are two main buckets of interventions or things that are done to ensure that our public, our patients, have access to appropriate rehabilitation. The first one, as you know, is clinical rehabilitation, which really consists of providing individuals who need them with healthcare interventions. And this can range from seeing a physical therapist, a chiropractor in the community, to having access to very significant and advanced interventions in tertiary care hospitals. But the other bucket of interventions that is really important in rehabilitation is what we call community-based rehabilitation. How do individuals with disability, with impairments, can actually contribute and live an active life in society? How do we adapt our workplace? How do we adapt our sidewalk? These things called community-based rehabilitation are essential to ensure that people with disabilities, a whole range of disabilities, can actually contribute. So today I'm going to navigate between the fields of clinical rehabilitation and community-based rehabilitation and offer some thoughts about how we and the university can really contribute to advancing this field. This very important study published in the Lancet at the end of 2020, in December of 2020, by the World Health Organization, had a very strong message for the global community. What we've learned from this paper is that today, globally around the world, there are 2.41 billion individuals who are in need of rehabilitation services and often cannot access them because of funding, because of access, because they live in remote areas, or because they live in low and middle income countries. And what is also surprising for a lot of us is that the main reason why people need rehabilitation services is musculoskeletal disorders, or pain or disorders that affects your bones, your joints, your muscles, your ligaments, such as your spine. In fact, low back pain is the single most condition, the condition for which there is the highest need of rehabilitation services throughout the world. And that is the case for 134 of 204 countries in the world. So low back pain is the main reason why people experience disability in their life. What's also surprising is that this problem is not only an issue in the low and middle income country, but in fact, low back pain is the main reason for needing rehabilitation services in Canada, in our country, in our province, and where we live. And as you can see, this is also true in South America, in Africa, in part of the Middle East and Southeast Asia. So disability related to low back pain and the need to provide rehabilitation services for these individuals is the main reason for lost productivity or loss of functioning in our communities. Low back and neck pain, in fact, are the main cause of disability in Canada and throughout the world, as I just mentioned, and they're the most common cause of medically certified absence, sickness, and certification. And they have led to the opioid epidemic that has been plaguing our nation for the past decade. In fact, people with low back pain and neck pain are very likely to use healthcare services. Roughly about half of individuals who experience some pain in their back will consult healthcare providers, and half of the costs are related to direct patient visits. The costs are rising exponentially. In fact, just completed an analysis of the cost of low back pain in Ontario, and the costs annually are close to $1 billion. The pandemic did not help with this situation. Last March, as you well know, and you're seeing me in my home office, we had to change our lifestyles. And our lifestyles changes have led to different ways in which we live. We had to take care of children at home. We had to take care of our elderly parents. We had to adapt our workplaces to be able that we function, make times to actually deliver on our work outputs while taking care of our loved ones. And these lifestyle changes have led to an impact on our health. The prevalence of sedentary lifestyle has greatly increased in our communities. Our sleep has not improved. It has gone down in terms of quality. A large segment of the population is now experiencing stress, anxiety, and depression Because we're less active and more sedentary, we have gained some weight, and also we have suffered, or we are suffering from social isolation. These are not new things for you. I know you are well aware of these changes that we had to adapt to. But what's also very important to consider is that those individuals in our community who lived with long-term conditions, these would be chronic diseases and disability, have reported to a Statistics Canada survey conducted last summer that their health had actually deteriorated. More than 50% of these individuals reported that their health is worse, has been made worse by the pandemic. 61% are now reporting to have worse mental health. But what is also very important is that about 53% of these individuals with chronic conditions needed medical treatment but could not access it. So there's been a real challenge for individuals with long-term conditions and disability to access their appropriate healthcare. And this is also true for those who needed rehabilitation services, such as physical therapy, chiropractic, and massage. About 42% of those could not access their treatments and therefore help with their disabilities. So what did people do, and how did our society and our healthcare system react to this side effect of the pandemic? Well, we saw an increase in the use of telehealth and virtual health services internationally. In fact, the World Health Organization reported that 63% of countries that are member states of the WHO reported disruption in rehabilitation services, and 58% of these countries had to replace in-person consultation with telehealth during the pandemic. Now, telehealth is not new. Its origin date back to the 1960s, but there has been a slow evolution of telehealth and virtual health and virtual rehabilitation really until the pandemic, which has led to a really rapid evolution of services. In the United States, compared to 2019, there's been a 50% increase in synchronous telehealth visits in 2020. This is basically, you need to consult your general practitioner, your doctor. You cannot go to the office. So therefore, you're likely to pick the phone or engage with your physician through a Zoom conferences. This is what synchronous telehealth is. And this has increased by 50% compared to last year in the United States. And what was really noticeable is that in the early phases of the pandemic, there was a 154% increase in telehealth utilization, synchronous telehealth utilization in the United States. And I would assume that we have faced a similar type of issue here in the country. Fortunately, most Canadians did not get infected with the coronavirus. But one of the side effects of the pandemic, again, was the reduced access to healthcare. And in fact, telehealth was used not primarily to treat COVID patients, but it was used to treat people's heart disease, arthritis, depression, diabetes, and other chronic health disorders. So what is telerehabilitation and what is virtual rehabilitation? Well, telerehabilitation is really the delivery of professional rehabilitation services at a distance using technology like we are doing right now. And this has rapidly evolved, more so recently, but over the past 10 to 15 years, into virtual reality rehabilitation. And this is what I'm really excited about and where I think our university can play a great role in the future. Virtual reality rehabilitation is really using technology to allow users to interact with a multi-sensory simulated environment and receive real-time feedback on performance. And I'll give you an example of that in a minute. So it's really about changing behaviors, adapting lifestyle using virtual reality rehabilitation. Gaming is a key component of these technologies. Now, do they work? Do people benefit from using telerehabilitation and virtual rehabilitation? So some of the work that we've engaged starting with in last spring at the Center for Disability Prevention and Rehabilitation, where I am the director, is to actually look at the overall body of knowledge, the overall body of science, to understand whether or not patients who use these technologies, these services, actually benefit from them from a health perspective. And the evidence is quite clear, and this is very, very important, that synchronous telerehabilitation, being in contact with your physical therapist during a session for whatever health problem you have, such as non-acute headaches, neurological disorders, low back pain, osteoarthritis of the knee and the hip, is actually similar in benefits to seeing a healthcare provider in person. So the idea that telerehabilitation is not as good as being with a clinician in their office is actually not supported by the evidence. People benefit from these interventions. Now, what about virtual rehabilitation, virtual reality rehabilitation? Well, again, looking at this evidence, it is clear that this is a promising and viable options for rehabilitation of musculoskeletal disorders, neurological disorders, and even mental health and cardiovascular disease. And this is really where I think the future of rehabilitation is going to be evolving in the next 10 to 20 years. Here is an example of a virtual rehabilitation intervention, which was just recently tested for people with chronic low back pain. Now, chronic low back pain is a really challenging disorder condition to treat because once you've had pain for more than 6 months, the course is really challenging for individuals. The pain tends to become chronic and it has lasting consequences on the ability of individuals to engage in their daily activities. So I was really excited when I saw this new intervention, which is basically using virtual reality with goggles that individuals put on their face for a period of 8 weeks. And they were shown little videos and music that emphasize the concepts of cognitive-based rehabilitation and provided messages about education, relaxation, mindfulness, escaping the stress of the daily lives, pain distraction games, and dynamic breathing. So individuals that were randomly assigned to receive the Ease VRX device received these virtual reality intervention, and it was compared to a sham intervention. People got the same goggle, but they were just provided with low-key videos and random music in their device. And the results were very exciting. The use of the virtual reality rehabilitation really had an impact on pain and disability in these individuals. So this graph shows the course, the progression of pain over time since the beginning of the trial for a period of about a year following the intervention. And what you can see is that there has been a constant decline in the pain reported by the individuals that was much more improved in those who received the virtual reality intervention compared to those who received the sham intervention. And this was also true for a range of other outcomes, such as mental health outcomes, and also the ability of individuals to engage in their daily activities. So the future is there for us, and this is an area of research that we are engaged in at the Center for Disability Prevention and Rehabilitation at the university. And there are some important unanswered questions that I hope I'll be able to tackle with my colleagues and graduate students over the next, in the near future. And these questions are not necessarily related to the medical interventions related to rehabilitations, but they're also related to issues related to equity and access. Is this technology easily accessible by individuals in all socioeconomic status in the population? What about individuals who live in remote areas where the technology may be harder to get? This is an important area of research that we need to involve in. What do we do with the rapid evolution of technology? How do we adapt current technology with very quickly evolving advancement? The concept of patient-centered care and shared decision-making, which is now part of evidence-based practice, will need to be adapted to the delivery of virtual reality rehabilitation. Simply often because we cannot touch patients, we cannot establish the necessary contact to engage with patients in shared decision making. Will we find ways to deliver these services in a cost-effectiveness way so that we can provide value-based care to our population? And finally, is it going to be safe for patients? Will it increase the rate of misdiagnosis or promote over-medicalization? By that, I mean, will it be a technology that will be used for people to actually access services when they may not necessarily need them? So I think that Ontario Tech is very well positioned to tackle these issues because 6 of our faculties can actually join forces. This is a challenging issue that needs more than healthcare intervention. It needs collaborations with our colleagues in the Faculty of Education, issues obviously related to equity, human rights need to be tackled with our colleagues in social medicine, sciences and humanities, computer engineering, technology with science, and in business IT, artificial intelligence and robotics. So I think it's our challenge. Telerehabilitation, virtual rehabilitation is not going anywhere. And I think that we can make a difference. So thank you so much for sharing a few minutes of your time with me today. And I hope we can engage in a Q&A. Thank you very much. Jody, back to you.
Thank you so much, Pierre. I'm sure I speak for all of us today when I say that we all learned a lot, and we will keep these tips in mind, especially when working from home, and be mindful of our ergonomic setup so we can eliminate that lower back problem that you talked about so much. I do have a couple great questions from the audience today, and the first one would be, do you think that VR rehabilitation will help expand the range of in-home services that can be offered?
Yes, I think that this is one of the goals of virtual rehabilitation, especially in populations that are either live in remote areas, in rural areas, or in individuals that have issues such as mobility problems. They cannot easily get to a clinic. Or even busy parents nowadays that have to double task with their work, the children, educating the children. So if they can take a few minutes in their home, use VR rehabilitation, then I think that this is a promising avenue to improve their chronic health conditions.
Great. And as a really awesome follow-up question, Dr. Côté, we were wondering what the VR rehabilitation will help, what kind of access do you need for bandwidth for those in remote areas to offer these kind of services as virtual rehabilitation?
Okay, I must admit, Jody, that this is beyond my knowledge expertise. I'm not well versed in the technology requirements for this, but I know having discussions with my colleagues in the Faculty of Business and Information Technology at the university, that really they are focusing on making sure that these are accessible. So therefore, using cell phone or other devices could be an avenue that is used to deliver these interventions.
Awesome. Now, we both can agree that the mental and physical health of our students is of paramount importance to all of us. So what would you like to see the university adopt virtual rehabilitation to best enhance our services that we provide here?
I think that I would start by focusing obviously on the mental health of our students now. And I know that the university has done tremendous efforts and is very conscious of these. And I think that developing virtual rehabilitation or virtual reality interventions with the students, understanding their needs, is really the way to move forward. So I would focus on mental health and then on promoting exercises and physical activity, because that is really the key to help with a lot of the issues that I've mentioned about today, from pain to sleep to sedentary lifestyle, obviously.
This is very exciting. Now, can this be offered in care settings, LTCH, by the staff there? Do they need specialized training? How do you see this working in conjunction with primary healthcare, such as chiropractors and physiotherapists?
Yeah, so obviously there would have to be a bit of a learning curve with the staff, but I'm sure that that can be managed well. And in fact, some of these interventions have been delivered or used in clinical setting on long-term care homes to complement the services that are provided to elderly populations or individuals who need rehabilitations for their musculoskeletal or neurological deficits. So this is also this is a very good question. Another avenue for these technologies is that they can complement what is currently provided in clinics and in hospitals.
Great. Well, I must admit, we are so lucky to have someone with your expertise as part of our Ontario Tech family, and the support that you give for our students is amazing. So thank you again so much, Pierre, for joining us today. This is our 4th annual Pi Day of Giving, where we are celebrating the infinite possibilities for our students here at Ontario Tech. It's been a difficult year for everyone, as we all can imagine, and I'm glad that we're able to switch to virtual learning within one day. We're really looking forward to being back on campus with our students soon. However, our students need help more than ever. So I really hope that everyone joining us today will make a gift in support of our Student Relief Fund to help students who are experiencing their financial need that were unexpected due to reduced or lost part-time jobs. And all donations to the Student Relief Fund are going to be matched dollar for dollar. For those of you who did make a gift when registering today, we do thank you. I'm pleased to share that we've already given out nearly $400,000 to students in addition to our regular scholarship and bursary program, which is just amazing. And in saying that, I would really like to also thank Kemp Travel Group for their generous sponsorship today for our Pi Day of Giving. I hope those of you joining us today will spend your lunch hour with us for the remaining of our speaker series sessions. You can find more details on the topics and speakers on our website on ontariotechu.ca/Pi Day. Thank you for joining us. Again, thank you so much to our Ontario Tech expert, Dr. Pierre Côté. Before we say goodbye today, I'd like to share a short message with you from our students here at Ontario Tech.
Thank you.
Thank you.
On March 14th, you can help support my dreams.
Knowledge is infectious, and my dream is to teach.
My dream is to educate young students about the benefits of physical activity so that they can adopt these practices into their daily lives.
My goal is to contribute to innovative technologies that leave a lasting impact on society.
On Pi Day, join our circle and support students like me.
I want to help save people from natural disasters.
I want to be part of engineering projects that help make tech be your best friend.
I want to develop technology to aid in space exploration.
I aspire to design aerodynamic race cars to shape the future of Formula One racing.
Just like the values of Pi, opportunities for students like me are endless, so join us.